Hey guys, I hope everyone's well and having a good day. It's a beautiful day here in New Orleans, so I wish we could all be together for our last class, but this will suffice. I took this class to fulfill a history requirement. With that in mind, I'd been waiting for a methods class that came out that piqued my interest, something that I wanted to spend my time taking. So I'm really glad that I chose this class because I've enjoyed it and I've learned a lot about New Orleans and Katrina and Louisiana. I was in first grade when Katrina hit, and being from Monroe, Louisiana, which is about 4 hours north of New Orleans, my hometown wasn't directly affected by the storm, but some of my most vivid childhood memories are about Katrina. I have a little sister, Ella, that was born in summer 2005, just a couple months before Katrina, and I remember one afternoon about a week after the storm had hit, my family and we were watching the news, and they were at the Monroe Civic Center, which had kind of been set up as a place for evacuated residents where they could come, and they had a ton of people there, and the camera, it zoomed in on this woman that was nursing a newborn baby on the concrete floor, and I just remember my mom stood up. She was so angry. She marched upstairs to my sister's room, got a bag full of all of Ella's baby's clothes, her diapers and wipes. My dad loaded up the rocking chair into the back of his car, and we loaded into the car, went to the Civic Center, found the woman from TV. My mom gave her all of these things. The woman was so gracious. She said it was the only help she had gotten in weeks, that she was worried about her baby, and my mom was just absolutely furious. I didn't really understand what was going on, but I knew, seeing my mom that upset, that angry, that I needed to feel that way too. Going into this class, I still didn't really understand the entire impact of the storm, which, looking back, it seems a little selfish, especially because I'm from Louisiana. But after a couple weeks, I knew that I wanted to research the healthcare inequalities in New Orleans. My dad went to med school at LSU, and I grew up hearing stories about his rounds at Charity. And to put it in his words, he said this on a phone call yesterday. We saw anything and everything at Charity. It was a special place where miracles happened. No wonder the government wanted it gone. So knowing this, I knew that I wanted to focus on the narrative of Charity. I began my research by exploring the history of the hospital. So in 1736, a man named Jean-Louis left his small fortune for the purpose of founding a hospital specifically to serve the poor and needy of New Orleans. It was built that same year and called St. John Hospital, and it was the first charity. So then over the next 200 years, Charity constantly fell victim to natural disaster and political neglect. It was torn down by hurricanes, fires, and then finally in 1939, the sixth and final charity that we know today was built with New Deal era funds and a lot of oil money during Huey Long's reign. And at the time, it was the second largest hospital in the country with almost 3,000 beds. It became the only hospital in the state where Black women could train to be nurses and where Black doctors had staff privileges. After Hurricane Betsy in '65, the state integrated hospitals, and as access to care improved, health inequity still remained a large problem, especially because traditionally poor Black neighborhoods suffered disproportionate exposure to environmental toxins, which is something that I look into. And then so before Katrina, 1/5 of New Orleans residents lacked health insurance, and Charity served as not only the hospital, the emergency room, but also as a primary care provider. And so the Katrina and the aftermath of political posturing just completely destroyed that safety net, leaving around 85% of New Orleans' poorest residents, those that needed the most help, without access to care. And so with that in mind, something clicked in my head. Is this why New Orleans quickly became a hotspot for COVID-19? Why, if Black people only make up 32% of Louisiana's population, are they accounting for almost 80% of COVID-related deaths in the state? These data points simply just bring to the forefront the long-standing disparities in outcomes in healthcare. African Americans have higher rate of diabetes, asthma, heart disease, and all of these are associated as risk factors for COVID-19. And then when also added to social risk factors like access to care, income, social status, we get this toxic gumbo that puts Black people significantly more at risk for contracting and dying of COVID-19. And then the social determinants of health come into play in Katrina, and by looking at these so-called unprecedented events of the storm and the pandemic and exposing the aftermaths, the social disparities and a history of racism in healthcare become clear. So with that theme of disparity in mind, I discovered a few parallels between Katrina and the coronavirus, and not so much so as using the convention center downtown both as a place for evacuees in Katrina and a temporary hospital now. I more so wanted to look at some of the lesser known things. So 40% of New Orleans residents didn't have cars to evacuate before the storm, and so we saw many of these people stranded, left to drown in the floodwaters, and they lacked access to the federal help. And again, we see these same residents stranded at home, lacking the means to go to a testing center or to obtain care. And so the federal and state disaster relief structure, it's only helpful for those that have the means to access them. And then again, we see New Orleans blamed for Katrina amidst this whole cycle of finger pointing. Everyone seemed to land the blame on the city. Why didn't Nagin get everyone out? Politicians across the aisle blamed the other side. The federal government blamed the state for delayed response and unorganized leadership. And then now, again, we see New Orleans blamed for this disaster. The media pins the crisis on Mardi Gras. The network of blame is just undermining the public health crisis in New Orleans, and it's just resorting to attack on the most vulnerable again. The outbreak in mortality in New Orleans is a direct result of political problems of inequality, healthcare privatization, and social orders that define the city and America as a whole. It's not about Mardi Gras. The ongoing pandemic, not a flood disaster quite like Katrina, still puts the same citizens at risk as the 2005 storm. The virus discriminates based on age, race, and social status, but these socioeconomic realities, which Katrina made so clear, come to head again with the outbreak of COVID-19, and we find ourselves again reckoning with the failure to find an alternative. And both of these disasters are revealing how wealth and privilege only benefit a segment of the city's population and just leave others without access to care, and honestly just leave them to die. It's so unfair and disheartening and disgusting. And in realizing the concept of these underlying conditions and their relationship with the longer historical narrative of unequal access to care, you can kind of recognize COVID-19 as more of a racist epidemic. And I hope that New Orleans and America also realize these factors and address the inequality in ways to better implement care, more efficient government, and increase access to health care for New Orleans and America as a whole. So thanks, everyone, and thank you, Professor Horowitz, for putting on a great class. Definitely the transition to virtual class wasn't easy, but you made it bearable, and I had a great time. I really learned a lot, enjoyed the class, enjoyed having class with my classmates, and thank you, Sarah. Hope everyone has a great summer and a great rest of your finals. Bye, everyone.